This is the G1 podcast.
이번 역은 서울역입니다.
What is up, everyone? Welcome back to the G1 podcast. I'm your host, GP, and thank you once again for joining me for the second episode of the new year. I think it's the 10th or 11th overall. Last week, I published part 1 of the New Year, New You concept that I was putting together for KoreaScape on TBS EFM right here in Seoul. What you're about to hear is part 2 of that series. I took the concept into a very literal direction by heading out to a very notable plastic surgery clinic in the Gangnam area and getting a consultation, talking to a staff member, a surgeon, and even a former patient to give you the inside scoop on what it's like to, well, get a new face. I hope you enjoy it. Here it is.
이번 역은 신사역입니다. 내리실 문은 오른쪽입니다. This stop is 신사. The doors are on your right.
Okay, I just arrived in Shinsa, walking out of this station that's filled with plastic surgery ads, walking over to this clinic. Oh, whoa. Wow, that's the building. It's like a skyscraper. I have to tilt my neck up to look at this place. It's enormous. It's easily one of the tallest towers here, and it's very attractive from the outside. I'm wondering exactly how much plastic surgery goes on in this building to warrant a structure of this size. And this is just one of the many plastic surgery clinics here in Gangnam. We're gonna go there and see, I guess, how we can improve on my face. I wish I was special. Immediately upon entering the building, I was greeted by 2 receptionists wearing clean white uniforms that gave off something of a dentist meets flight attendant aesthetic. The only other thing in the white and beige toned lobby that prevented it from being outright sterile was a gigantic Christmas tree, a reminder that it was peak season for plastic surgery tourism. After checking in, 2 PR staff members escorted my team member Jamie and I to the 15th floor, where we started the first steps towards getting a new face. So we're up on the 15th floor now of ID Hospital. This is the lounge, and you can see essentially all of Gangnam. I can see the river. It is really nice up here. It actually just feels like a rooftop cafe. There's a price for females for this, for Botox. I'm sure that's in 10만 won, right? Wow, dude. There's all the business cards of all 30-something surgeons here. So inside this waiting room lounge area, I just noticed on the wall there's a magnetic, looks like a map of the world, kind of. It's got Polaroid pictures of all these girls who've had surgery done here, and there's little messages in different languages. So one says, now I can smile. The other says, my nose is so natural. One says, greetings from Australia, we'll be back in the spring. One says, do you like my eyes? And it's literally every single continent is represented. It does make me feel like what they've got done here has really had a positive impact on their lives.
안녕하세요. 저희 일단 차트 작성부터 먼저 하실게요.
Alright, filling out a form, it's in English. The first step to getting a new face is filling out forms. Which part do you want to consult? Long face, mandible, progantism, malocclusion, protruding asymmetry, mouth, big cheekbone, mandible angle, V-line, absent face, fullness, and volume, mini V-line, double chin, sagging skin, others, revision. So this is the number 2 question. What's your motivation for surgery? Number 3, how long have you been troubled by your appearance? Am I more beautiful yet? Not yet. While I waited my turn for the pre-consultation facial x-rays, I got a chance to speak with the clinic's international coordinator and pick her brain on the typical demographic that chooses to undergo plastic surgery.
My name is Hedy Park, and I'm in charge of marketing for international patients. We get a wide range of patients, but most of our patients will tend to be in their 20s or 30s. But nowadays, there is a high demand for middle-aged women, often after having a baby, who desire a mommy makeover, which will usually include anti-aging procedures along with the breast augmentation and body contouring surgeries.
I obviously didn't fit the typical demographic, so I asked her about the growing trend of plastic surgery amongst males.
If we think back to like 10 years ago, the percentage of male patients was probably about less than 10%. We feel this is because even like just 10 years ago, gender equality in Asian countries, specifically Korea, was near inexistent. Men were the moneymakers, whereas women were more discriminated and judged based on their appearance. But nowadays, as the social position of women has become higher, like men are required to focus on self-development by enhancing their appearance. Thus, the increase of the interest and demand of male plastic surgery become higher, I think.
And since I'm also an expat, I was curious about what's popular amongst foreigners who elect to have facial alterations.
Depending on their like cultures, every countries have their own standard of beauty. But nowadays, like K-drama and K-pop is on the rise. Everyone's thinking about the Korean standard beauty as well. Yeah, which is like large eyes and slimmer nose and small and defined facial contour. So nowadays I have many inquiries asking for I really want to have small face, defined jawline like Korean K-pop stars.
Then we moved to the 14th floor where I was to get my facial x-rays. While I waited, I felt something that I never would have anticipated. So we're on the 14th floor now, awaiting my checkup, and even though I know that I'm doing this as like a professional thing, my heart is actually like, it's beating. This is, I don't know if I'm excited or I'm nervous, but there is an air of anticipation, anxiety, anxiousness. So I'm really curious as to see where and how this goes. Now we're being called in for our checkup.
Hold this one. Hold this one.
This is the x-ray machine?
Yes.
Okay. Getting my face x-ray done now.
Please move back. Okay, and bite here.
Okay.
Bite.
There's literally a laser crosshair on my face and something pinching the side of my face.
촬영을 위해 준비 중입니다. 촬영이 완료되었습니다.
Okay, finish.
드시고 안내가 있을 때까지
감사합니다.
기다려주세요.
That was like going through a security checkpoint for just my head. After my x-rays, I was escorted into a consultation office where I met with a surgeon who I assumed would be responsible for crafting my new look. The first thing I wanted to know, what was the ideal face to him?
I'm Dr. Chang. My name is Singil, and I'm the director of ID Hospital, and I'm specialized in facial bone contouring surgery. There's no absolute standard of beauty, right? If you think there's one beauty standard for all of Korea, we're crazy, right? There are 50 million people in South Korea. That means there are 50 million different options, right? However, there's a trend. These days, big, bright eyes, a slim nose, small and slender face are thought to be beautiful.
When you first started, what was the trend then? So you said now larger eyes and a slimmer nose. What was the trend in 2002 when you first started?
Okay. When I started to do the plastic surgery, there's no concept of a small face or V-line. But these days, with the development of surgical technique, now V-line shaped facial features are getting popular. The V-line surgery was developed in 2008. It's been about 7 years, right? Yeah. Before that, there's no concept of V-line.
Before we move on to the very reason I came to the clinic that day to get my plastic surgery consultation, I realized that you, my awesome and probably beautiful listeners, must have no idea what I actually look like. So to give you some context, I went around asking people how I could improve on my face. These were their answers. How would you improve upon my face?
Well, I think guys shouldn't look so hairy, so you're probably gonna need to get all of your hair taken off and your eyebrows, trimmed up a little bit.
I would say to improve on your face, you should probably smile more. You have a really serious face going on. So if you smile more, I think that people might think that you're more approachable.
Trimming those eyebrows a bit, maybe plucking a bit. I don't know, man. That's like weird. I like normal, I guess.
I think the most important thing is to be interesting. So maybe a or a cool scar that has a story behind it, or something that makes you unique and distinctive and reflects your personality.
If you're talking about like Korean context, maybe higher cheekbones, higher nose bridge, making your eyes bigger actually. Oh, you have aegyosal, so we might want to expand on that. Maybe your jaw a little sharper, because like that's what the stars are really into right now. I don't know, maybe.
Thanks to everyone who contributed to that. I certainly appreciate your candor. Let's get back on track now and hear what recommendations our plastic surgeon had for my face. We're looking at an x-ray of my head.
Mm-hmm.
So it starts with your skull.
Yeah.
Okay.
Okay, this is your facial bone shape.
That's 3D, that is computer graphics.
There's a slight asymmetry in your cheekbone. The left side is bigger than the right side. And the lateral protrusion is more severe on the right side. And there's also asymmetry in mandible. The left side is longer than the right side. And
you can see that just by looking. You can see all these things.
Sure.
This is why you're the surgeon.
Yes. And your chin is slightly long compared with that of a normal person. Okay?
Wow.
But, the occlusion is quite normal. And, quite good.
Now that you've mentioned these things about like the lack of symmetry, I can never unnotice them, doctor. I'm always gonna look at me and be like, oh, that side's a little bit longer now. Now I know.
Yeah, nobody noticed that you have asymmetry in your with your mandible or cheekbone, right? But I'm a specialist, so I can notice. I think your facial contour is quite good, so you don't need to get facial bone surgery. Instead, at the first sight, I was impressed. Your nose tip is too bulbous and very flared, right? So if you want to get plastic surgery, I do strongly recommend rhinoplasty. That's enough.
I was thinking before we came in here, if I had to guess what kind of surgery would be recommended, I think it would be the nose, because I have many Southeast Asians have this button kind of nose where it flares out, right? So you would recommend a rhinoplasty for me. I don't know what that would look like. I can't even imagine. Right.
Okay, we can show you some examples through the the simulation surgery.
Okay.
I can show you.
I would love to see that. So it seemed like a nose job was the only improvement Dr. Jung would have recommended for me. I wasn't quite feeling compelled to undergo any sort of voluntary invasive surgery, but I asked him what would compel others to get work done.
Yeah, we live in a very competitive and stressful society. In order to strengthen our comparative power, we are forced to have a good appearance as well as good education. People invest in surgery hoping that it will help them improve their careers as well as their social lives, I think. I think more than 80 to 90% of the patients are doing plastic surgery for aesthetic purpose. I mean, aesthetic is the main point, but not always. Sometimes the patients come to our clinic to correct their asymmetry or correct their functional problems like TMJ. I was beginning to sense that Dr. Jung had been a bit too well prepared for all my questions, so I decided to shift gears by asking him something a bit on the personal side. What he told me was perhaps the most convincing argument for plastic surgery that I'd ever heard. I have some questions for you personally. I hope you'll be willing to entertain me. I would like to know why you decided to pursue this career for a living. When I was training in University Hospital, actually I decided to be an orthopedic surgeon. But there are lots of orthopedic surgeons in Korea, so I'd like to do a more specific and a unique job as a doctor. So the plastic surgery part is quite complex and very attractive to me, especially the facial bone. Korea is a very competitive society, right? Women in the workplace are still discriminated on the basis of the way they look, right? So they are seeking for another way to strengthen their ability or strengthen their comparative power. So the plastic surgery can do good for them, right? Through the plastic surgery, they can gain the self-confidence again, and they can go back to the daily life. And that achievement made me happy. There was a tangible sense of pride that emanated from Dr. Jung's words, which would have been enough to convince me that he's good at what he does, but I was actually given the opportunity to experience exactly what he was talking about when I was introduced to one of his former patients.
My name is Hayden, and actually I'm from Oakland, California. And so I came here about 3 years ago and underwent surgery with actually Dr. Jung, and at that time must have been maybe around 2012. So originally what I wanted to do was the nose and jaw, and so I didn't really have, so it was nose, eyes, and V-line, and so I didn't really have an interest to do eyes, to be perfectly honest. But then when I came in for the consultation, I wanted to change my nose because at the time my nose was, actually I didn't have an Asian nose. I had a very larger nose. I had a very tall, large bump nose, and so I didn't have your typical Asian flat nose that needed where the bridge to be up. So I had the exact opposite. So what I wanted a little bit more of an Asian kind of feel for my nose. As for the jawline, I didn't really want to change it so much, but I wanted to correct the symmetry.
Dr. Jung had already given me a few examples of why people typically elect to have plastic surgery, so I was eager to find out what Hayden's particular reasons were.
You know, I think a lot of patients do it because they want to overcome insecurities or they want to gain confidence. I think for me, I don't think I ever lacked that confidence because of my flaws or because of my looks. Ultimately, what it was is the way I looked didn't portray my personality well, because me having a big, long nose, it's just kind of like if you see someone with that witch nose, I don't know, you don't get that sweet image from that kind of look, I think. I think it made me look a lot more maybe rugged or a little bit more rough, and I don't think that was what my personality was. And so not that I really cared that much, but then it did kind of have an effect on me. So even like with when I went back, a lot of people said that I didn't look that different, but when I specifically took pictures, I didn't look kind of like that mean girl anymore.
A reflection that matches your self-image is quite rare, whether or not your appearance has undergone any dramatic changes. Hayden's off-the-cuff answers were quite refreshing, so much so that I was curious as to why she was so open to talk about her experience so publicly.
That's actually a really interesting question. You know, I could really answer that right now. So what it is actually, 2 years ago, I think I was really embarrassed about it. I never wanted to admit it. I think I even erased all my pictures from me. I erased everything, and I really regret doing that. But at the time, I think for me, it's like I never actually talked about plastic surgery prior to getting the surgery done, so no one knew. Like I just came to Korea, basically is what it was. I never told anyone, and then I think I felt a little bit embarrassed. And then I didn't really want to admit it, and I don't think I was educated well enough about plastic surgery to want to talk about it openly also, because I think in my circle of friends, not a lot of people even, know about it. I think that's the reason why I really didn't want to tell anyone. But then after the surgery, then after a couple months passed, and maybe after even a year passed, I think I started to really not care. Like really, and even so, I think I even felt that I became a lot more grateful. I don't really feel ashamed to tell things or say things. And for this topic specifically, I think that I feel ashamed that I felt ashamed. And so that's why I feel like I should talk about it.
Finally, I asked both Hayden and Dr. Jung what words of wisdom they had for me, as well as all those entertaining the idea of undergoing cosmetic surgery.
I guess what I would have wanted to hear, or what I wanted to know at the time was, it's not as bad as you think. I think there's nothing wrong with ever wanting to improve the way you look, I think. And I think if you want to undergo surgery, I think that's your business. It's your money, it's your time, whatever, it's your business. But I feel like you should never feel like you really need to or you have to. I think if it's gonna be your choice, then it's ultimately your choice. But if you feel like, oh, all the girls, they're so pretty, I want to be like that, I don't think that's it. I think you got something else you need to work on rather than surgery.
Deciding whether or not this is really something you need. Take time to think about it because its style changes and phases pass. So do your research. Find the right doctor and the right hospital you can trust. People who aren't really sure if they want to get it or not. Some patients may feel incredibly pressured by the society and feel that they need to change in order to fit in. Like I mentioned before, styles change and phases pass. So the patients should be able to know and to decide on their own that this is really what they want and what they need.
If you're wondering, I will not be getting any work done on my face anytime soon. As always, thanks a million for listening and supporting by liking my Facebook page. Just search G1PDCST, and most importantly, sharing with your friends. Goodbye for now. I'll catch you in the next one. I'm GP, and you've been listening to the G1 Podcast.
이번 역은 사당